High schools and colleges are now beginning their training and conditioning for fall sports. But when you're active outdoors in hot, humid weather, the kind of weather we have now, well, you need to be alert for signs of heat exhaustion and heat stroke. Joining me now to explain is Dr. Peter Schulman, a cardiologist with the Pat and Jim Calhoun Cardiology Center at UConn. Doctor, thanks for joining me.
Good morning.
Good morning. So let's talk a little bit about the difference. Is there much of a difference between heat stroke and heat exhaustion?
I think it's just a matter of degree. Certainly heat exhaustion can occur in hot weather. If things get out of hand and people don't take corrective measures, it can become heat stroke, which really would involve some changes in mental status, fainting spells, or loss of consciousness.
Let's talk about more of the warning signs. I know you touched on a few, but what really triggers your mind and your body saying, okay, something is wrong?
Certainly excessive sweating is one of the symptoms that we need to be careful of. Headaches and fast heart beating are other symptoms. In addition, if people feel dizziness, that can occur in the hot weather as well. So the headache is a problem, nausea can occur, anything feeling unwell during the course of physical exertion that's really out of the ordinary, out of what one would expect with activity.
I'm trying to picture football practice and a bunch of guys, and they're having a good time and they're practicing and they're pushing through it, pushing hard. And I just don't see one of the guys saying, I don't know, I just don't feel that great. I'm afraid that they're going to feel as if they're weak or wimpy to say something. And you're saying you've got to speak up.
Exactly. It's sort of a macho thing. People don't want to complain about being hot or tired. They want to be best of the pack. They want to show off for the coaches. Fortunately now, coaches are better educated. They know some of the warning signs. They know to provide adequate hydration. They know to provide adequate rest. And they allow the players and the players to get in the shade and to get some cool down time between vigorous sessions.
What else can perhaps athletes and coaches do aside from a couple of rests, some water breaks, some shade breaks, anything else that you're suggesting that they could do to prevent these problems?
I think education is very important to know that this can be a life-threatening condition. It's not you have to bypass the macho thing.
Yes.
and be conscious of one's health, because you can get seriously injured or you can die from this condition.
And before we go, sudden cardiac death, it rarely occurs in athletes, but it can usually be prevented with proper testing. Is that right?
It's a controversial area. In the United States, it is required to do pre-participation screening that involves physical exam, some detailed health questions. Interestingly, in other countries, they require even more stringent testing than is done in the United States.
It's better to be safe and prepared.
Absolutely.
Thank you so much. I appreciate this. I know a lot of athletes and coaches are listening to this thinking, you know what, we do have to take precaution because it's a very serious topic.
Absolutely. Be prudent.
Okay, that's right. Thank you so much.